The breaking news we're following right now, the U.S. shattering its record for new single-day coronavirus cases as the pandemic rages across the country. And the Centers for Disease Control and Prevention has just revised its forecast, is now projecting that as many as 40,000 additional deaths here in the United States in the next 3 weeks. Joining us now to discuss this and more, the Health and Human Services Secretary, Alex Azar. Secretary Azar, thank you so much for joining us. This is a pretty dire forecast from the CDC. The virus seems to be running rampant right now. Tell our viewers what the Trump administration is doing right now to get these numbers down.
Yeah, Wolf, so what's really important is we want to change that trajectory, and we change that through our individual behaviors by washing our hands, watching our distance, wearing our face coverings when we can't watch our distance. And it's important right now, especially as it's gotten colder outside. We need to stay out of settings, especially if we're vulnerable, like indoor restaurants or bars, if they're overcrowded, places where you might take your mask off or let your guard down, and especially household gatherings with neighbors and family members. We're seeing so much transmission there because you just don't wear your face covering in those settings. You let your guard down. We're seeing that. And, you know, it's not unique, Wolf. I've talked to all of the G7 health ministers, and Western Europe is seeing exactly the same phenomenon. People are tired. They're sick of the community mitigation. The masks are wearing on them, so to speak. You know, Europe right now is experiencing 45% higher per capita cases per day than even the United States is. But we want to turn this around, Wolf, by good individual behaviors, because we got hope. Yeah. We have vaccines and therapeutics on the way or here already. I want people there for that.
Yeah, I want to talk about that, and I'm glad you're speaking out. You're going on television as you are right now, telling the American public what needs to be done. But where is the president? Where is President Trump on this right now? Americans are dying in huge 1,800 yesterday alone. We haven't heard from him in more than a week right now, except he tweets a little bit. What's going on? Why isn't he addressing the American people as you are?
Well, Wolf, I'm his health secretary, and I'm trying to get the message out there, and especially on face coverings. You know, we just at CDC in the last couple of days put out the latest evidence that masks work. You know, at 1 meter, we tested at 1 meter. If both people are wearing masks, it can reduce the viral transmission by up to 70%. And for the first time ever, we have been able to show that the mask not only protects from somebody who's infected spreading disease out, but protects you, the recipient. And so my message to you is wear your face covering, and if somebody around you isn't wearing their face covering, let them know that they're putting you at risk also.
Well, I'm grateful to you for saying that, Mr. Secretary, and it's really important. But with all due respect, it's one thing for you to say it. It's another thing for the president. If he were to say to his supporters and all those who voted for him, it's critically important, as you just said, to simply put on a mask. So simple. Simply wear a mask. Thousands of Americans will live. He should be doing that right now instead of tweeting about Fox News, right?
Well, Wolf, I just hope the American people hear these messages from all of us. We're all over the airwaves, and we're saying this. And you know why? Because we had a historic week in public health. Pfizer announced a vaccine with 90% plus efficacy. That's almost unheard of. That same day, we authorized Lilly's monoclonal antibody to help keep people who have been diagnosed as positive, who are at risk of hospitalization, to keep them out of the hospital. Last night, Moderna announced they hit a critical milestone on their vaccine trials, and within days, we may see trial results from them. And this afternoon, we announced a unique partnership with America's pharmacies to administer an eventual COVID vaccine, so people in underserved rural areas will have access to vaccines the way they get their normal vaccines. 90% of us living within 5 miles of a pharmacy, and pharmacists being some of the most trusted people in healthcare. So we're really trying to advance it. I want people to act responsibly because there's so much hope for the future, but we need you to stay safe now, because I want you to get to that point where we pull through this.
Yeah, and there is a really, really encouraging word on both a vaccine as well as therapeutics, and all of us are hoping that works. It's going to take some time, though, to get the final results and make sure they do work. And what you're doing with the drugstores also very, very important. Here's something else that I've suggested needs to be done. The White House Coronavirus Task Force experts like you and Dr. Fauci and Dr. Birx, Dr. Redfield, why aren't they meeting already with the incoming Biden administration Coronavirus Advisory Council? to start briefing them on what you know so that when President-elect Biden takes office on January 20th, they're ready to go, because American lives, as you well know, Mr. Secretary, are at stake right now.
Well, Wolf, the important thing for the American people to know is that Vice President Biden's plan to deal with the coronavirus is eerily reminiscent of our plan and what we've been executing on and what we're executing on now. They say we need PPE. We have been producing PPE. We've got 30, 60, 90-day supplies at our nursing homes, hospitals, states, and the national strategic stockpile. They said we need to have testing. We've got over 120 million tests available in the month of November alone, 70 million of them rapid point-of-care tests. They said we need to have vaccines and therapeutics invested in. We put billions in, and we've delivered vaccines and therapeutics that are coming to the American people. So I think there's a lot of continuity no matter what the circumstance. Obviously, if there's a transition here, we're going to ensure that it's a professional, cooperative one, because our mission is protecting the health and welfare of all Americans.
Because at risk right now, the lives of thousands and thousands of Americans. I would be encouraged, and I hope it happens very soon, if you and the others started meeting with Dr. Vivek Murthy, former Surgeon General of the United States, and others who are helping the president-elect get through this. It is so critically important. You mentioned, and this is really important on a practical level, a new partnership with pharmacies to provide vaccines across the country. Tell us how this will work. The Pfizer vaccine, it has to be refrigerated at a really low temperature. I don't know if a lot of these pharmacies have refrigerators like that.
Yeah, so Wolf, by the time we'd be doing that broad pharmacy distribution, we'd be into larger mass public vaccination campaigns. So initially in December and January, we're going to be having very targeted vaccinations, also helped in large part by some of our largest chains like Walgreens and CVS. So in December, what we've said is we believe we'll have enough vaccine for all of our most vulnerable citizens to get vaccinated. Then January, enough for all of our senior citizens as well as our emergency first responders and our healthcare workers. And then we would move into progressively, as supplies come off the line, vaccinating more and more Americans to the point that by the end of March to early April, we think across all of the vaccines that we have invested in, we'd have enough for all Americans who wish to get vaccinated. And it's really during those stages that this broad community pharmacy program will be available. You're right about the Pfizer vaccine and its cold chain storage requirements, but we have many other candidates that are coming soon, we hope, that will have a lesser cold chain, just simple freezer requirements, for instance, that will enable that type of vaccination program.
We got to go. I know you got to run, but what's the most important thing the American public should think about as we get ready for Thanksgiving?
Well, if we've posted guidelines and recommendations at cdc.gov, coronavirus.gov, as you think about your Thanksgiving gathering, please address those circumstances there. Reduce the number of people at your gathering. If you can open the windows, let more ventilation in. We've got very practical things. Even if you have a ceiling fan, set it so it pulls the air up instead of down. Use single-use servings for individuals. Wear your face coverings, because I want to make sure, even if we make sacrifices this Thanksgiving and Christmas, those sacrifices are for a reason, so that everybody you want to be with will be here for next Thanksgiving and next Christmas.
And as I said, I'm grateful to you, Mr. Secretary, for saying that. I would be grateful, if very pleased, if the President of the United States were to follow your lead and say the same thing, because there are a lot of Americans out there who support him, who are totally opposed to putting on a face mask, to wearing a mask, and that is so dangerous right now. Mr. Secretary, please come back. Thank you so much for all you're doing. We really appreciate it.
Thank you, Wolf.